Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
You know, Tracy, it is really hard to avoid stress these days with so many competing demands for our time and attention. Now, my life's pretty easy, but I know you got a lot on your plate.
Yeah, so laid back and easy.
Well, we may not be able to avoid stress, but it is important to understand how we react to stress so that we can manage it and avoid the health consequences like overeating, smoking, even depression.
Yeah, one of the first steps toward good stress management is understanding how you react to stress, making changes if necessary. Research has shown that we manage stress differently, especially when it comes to gender.
Hard to believe.
Here to discuss her research on stress and demographic differences is Mayo Clinic internal medicine specialist, Dr. Anjali Bhagra. Welcome back to the program. It's good to see you again.
Likewise, it's fantastic to see both of you. Thank you for having me here.
Dr. Bhagra, thank you very much. And it's a topic that everyone has to be interested in. And the introduction suggested that we manage stress differently, individuals. How do you know that?
So I know that just from anecdotal experience and being a woman and living with my husband. But there is actually research. It's all observational research, survey-based research. So much of this is observed differences versus a randomized controlled trial. So we have to keep that in mind when we look at these numbers from survey data. But it has been shown that men and women report stress differently. They perceive stress differently. There are different reasons why they get stressed, and they do different kinds of things to manage their stress.
Why is it important to understand or know why men and women report these things differently? Why is that something that you study?
So I think the key essence of stress management, the number one thing is awareness. I think that's a huge part of stress management. Having an awareness that there is diversity in perception, reporting, and management of stress is the first step towards stress management. The next step is paying attention to what causes our stressors. And the third step is having a plan. So if we start out with awareness and realize what some of these differences are, I think it really sets us up for more success with stress management.
So the first thing you said is that men and women perceive stress differently. And in what way?
So first off, the reporting of stress, if we look at women versus men, women report a great deal of stress. More number of women report a great deal of stress as compared to men. So it's somewhere around 28% women versus 20% men. Not just that, women, the kind of things that stress women out are reported to be different. So for example, more women cite finances and money to be a big source of stress, whereas men, on the other hand, based on these survey studies, report work-related stress to be a dominant source of stress as compared to the reasons cited by women.
Yeah. And are you saying too that men and women will say, yes, I am stressed, yes, this stress is affecting me differently?
Absolutely. That is a great point, Tracy. Thanks for bringing that up. Actually, women perceive a stronger impact of stress on their overall health as compared to men. Now, we all know this isn't a generalization, and we know people that are vice versa and don't fit into this model, but generally speaking, women tend to perceive a greater importance of stress management as compared to men when it pertains to health.
So it's interesting you said the number one stressor for women is finances, money. Mm-hmm. Number one stressor for men is job, their job. So I presume then you can tell us that men and women also handle stress differently. Tell us about that.
Yeah, actually, that is a very interesting phenomenon that has been reported in this large survey from American Psychological Association. Women tend to have a more tend and befriend response to stress versus men who have a more fight or flight response to stress. And keeping that model in mind, more women actually enjoy activities such as reading and spending time with family, statistically speaking, and men actually like more physical activity, more number of men as compared to women, so playing sports, working out. Although the trend is changing because we know life in 21st century is slightly different than even a decade ago. I mean, if we just look at the past decade, more number of women are coming out and working. So there is perhaps a slow change in these demographics, but for now, we know that those are the main reasons for stressing men and women out.
Do you think that the stress level in women is higher than in men because women have so many jobs? They're not only their career, but also their family and take care of their husband. Is that a huge stressor?
You highlight a very good point there.
He's trying to earn some points at home.
Yes, I guess. So we all know we all have many unfinished tasks every day that drive our stresses. And it turns out that number for women is higher than men. Not just this, there are actually some not fully understood, but some plausible biological reasons behind these differences. Over the past decade, neuroscientists have done bunch of studies on structure and functional differences in the brain in men and women, and reinforced those to be perhaps some foundational reasons why some of this happens. So for example, women tend to have a very high metabolic rate within the default mode network in their brains. They also have a different pattern of connectivity of neurons in their brains. Neurons are the brain cells. So they actually have a higher, what's called functional density connection in their brain.
An FDC.
FDC. Yeah. And that's really mapped out on very sophisticated functional MRI tests. So I think it's becoming really fascinating how some of these differences, biological differences, pan out. You already highlighted some societal differences. There are also plausible hormonal differences. We know women go through all sorts of hormonal phases, premenstrual, menopausal, postmenopausal. So I think it's complex, and we can't pinpoint one area that contributes vastly, but it's multifactorial.
I just think it's interesting that you're using stress and how people react to stress as part of how you're going to ultimately end up treating patients, because isn't that why you would be doing this research?
This is exactly why we would be. And I notice this pretty much every time I go in for a stress management consult with a patient. Just having a discussion about this is hugely releasing, because relationships are a big cause of stress these days, believe it or not. And when people appreciate that, it's not a choice that the other person is making in a relationship, but probably some biological reasons as well that cause people to behave a certain way, I think they have much more appreciation of people in relationships.
So are the patients that you see referred to you from other providers at Mayo because the person tells their physician or provider that I'm really stressed, what do I do? And then they send you. Is there a stress management center here at Mayo? Where is it?
You're absolutely right. We do get patients referred to us by our physician colleagues within the executive medicine practice. And we see patients for a full 1.5 hours and discuss all of these reasons behind what causes stress. And of course, we walk them through the Mayo Clinic program on stress management during these consults.
The Mayo Clinic program on stress management. There is such a thing. And you walk them through the program, teach them how to deal with stress.
Absolutely. It's a stress management and resiliency training program, which is very comprehensive. And we are able to do this within a 90 minutes visit, give them a flavor of what it looks like, help them understand the reasons why this happens, make them aware of the brain-heart network, if you will, and how the stress is caused, and then how to effectively deal with it.
I like it. We have her on the program 9 or 10 times if we can do the whole program.
I would be happy to come back.
Tag team with Dr. Soon, just back and forth every
Absolutely.
week.
Dr. Anjali Bhagra, internal medicine specialist, stress expert, thanks so much for being with us.
Thank you for having me here.